Hi everyone, so this is Mr. Jen and it's glad that we can meet together during the Chinese Lunar New Year. So for this videos, we will mainly talk about the 4.5, chapter 4.5. So for 4.5, we are talking about some sex educations which is somehow related to maybe how we will become a parent. Okay, so in fact for pregnancy we notice that in fact it is somehow related to the fertilizations of the sperm and also the eggs, that means the ovum. So in this case, for in this when they combines together with, we say that in fact it formed the cycle. So when the cycle developed, so keep on doing the cell division, in fact in this case we will notice that it eventually it will turn out to become a baby. And in fact, how can we know that we are being pregnant? So we can base on some early signs of pregnancy. So for example, when there is absence of menstruation, feeling of wanting of vomit, or change in appetite, frequent urinations, or with a bad mood, or feeling tired easily. So these would be some early signs of pregnancy. But above all these signs, in fact, the most reliable sign would be the absence of menstruation, because we notice that where we have the baby, we will stop the menstruation. So how can we check, okay, whether we are being pregnant? Okay, so we can use a special stripe, which is what we call the pregnancy testing stripe. So it really looked like the COVID-19 stripe, or the COVID test, the test kit for the COVID test. So we can use this to obtain what we call the preliminary results, which is, you can think like um, a brief result. So it may not be very accurate, but it do got somehow to 80% to 90% accuracy. But if you would like to have a more reliable test, then in this case you need to visit a doctor to do a further or a more detailed examinations whether you are pregnant or not. So being pregnant, so a pregnant woman should take extra care to keep herself and the fetus, we call the baby, in fact we call it the fetus, okay, so healthy. So we do have some things that is do's, that is something that we need to do. For example, we need to have a balanced diet, we need to do a gentle exercise, we need to have enough rest and sleep, and we need to have the regular parental checkup, so before the laboring. So apart from that, okay, we do have something that is not suggested or not to do so. For example, we should not smoke, we should not drink alcohol, and we should not take any medicine without the medical advice or the doctor's advice. So in fact, we can notice that for smoke, in fact, it could somehow may cause the genetic mutations of the fetus. So in this case, smoking is one of the things that we should prohibit during the pregnancy. So how can we check like some techniques in parental checkup? In fact, a pregnant woman need to regular checkup to monitor their body weight, body blood pressure, and also the composition of blood and urine, etc. So various techniques have been developed to monitor the health of the fetus. So what will be it? Okay, the first one will be the producing an image of the fetus, which is the baby. Okay, but it not yet become a baby, so it is some early stages of the baby. So we can use the ultrasound scanning to tell the stage of the growth and also identify whether there is any problems in the body structures of the fetus, because sometimes when we do the scanning, we will spot that in fact there will be some disease or maybe some body structure does not develop very well in the fetus stage. So in this case, we can use the scanning and also the ultrasound scanning to help us to identify the problems in the body structures. And in that, for the ultrasound scanning, in fact, we do have two types. The first type would be the 2D scan, and while for the other type would be the 3D scan. So apart from that, we can also examine the DNA of the fetus. For example, we would take small amounts of the amniotic fluid around the fetus using a long needle. So in this case, we can find out, okay, so whether there will be some genetic disease or whether there is any problems in their internal structure. So in this case, in fact, these techniques required a very skillful, how can I say, a doctor or a nurse to conduct it, because in fact the long needle must only input into the amniotic fluid, but not the fetus, because sometimes the fetus may somehow move a little bit when the ultrasound scan checking of the positions of the fetus. In this case, the long needle, in fact, is very skillful. They need to very carefully to input to the bodies, and will only extract a little amount of amniotic fluid. So in this case, normally this would be somehow uh, it is quite costly for this technique. So but just now I've already mentioned why we need to examine the DNA of the fetus DNA by extracting some of the amniotic fluid, because by examining the genetic materials in the cells, the fetus cells, in fact, there will be some cells in the amniotic fluid. Then in this case, we could try to extract these cells and find out whether there will be any genetic disease. So the doctor will try to examine these cells by telling if the fetus has any genetic disease. However, I've mentioned, because it needs to be very skillful for the nurse to or the doctor to do such actions, because this may somehow harm the fetus. So in fact, a team of scientists led by the Professor Low found that fetus release its DNA into the mother's blood. So in fact, we can also, based on using this technique, we could also do some research on it, so that we could find out the genetic materials, not only about the fetus, but also about the mothers. So in using this way, in fact, okay, we can just simply get the mother's blood, and in this case, rather than getting into the amniotic fluid, we'll just extract some of the blood from the mothers. Then in this case, we can check whether the fetus DNA will be like containing any genetic disease, etc. So for this technique, in fact, is really new, and somehow it is now it's become more popular now. However, some of the genetic disease maybe coming from the fathers may not be able to be detected. So a newborn babies need a lot of parental care, for example, by providing food, clothing, shelter, and also education, so that for a parent, okay, they need to ensure that their children can survive, grow, and also develop properly. So humans and many other mammals will provide food for the newborn baby by breastfeeding. So what does this mean? Okay, so we can see from the pictures. Okay, so in fact, the babies will try to feed on the milk produced by the mother, and in this way, for the babies, in fact, they could contain all the necessary nutrient for the growth. And as it is in milk form, which is in a liquid form, in this case, it will be easy for them to just digest and also absorb the nutrient inside the milk. So apart from that, if the babies is fed by the breastfeeding, in fact, it would be better for them to have a better immunity, and they will also have a lower risk of allergy. And apart from that, they will have the greater sense of safety. And for the mother, in fact, for them to have the breastfeeding, and that it will be faster for them to recovery of the uterus after giving birth. And apart from that, it will lower the risk of cancers of the breast and also the ovaries. And furthermore, it will have a greater bonding between the mothers and also the babies when using these methods. So, in conclusion, the most reliable sign of pregnancy is the absence of menstruation. Okay, menstruations. So in this case, parental care is very important for the healthy growth of a baby. So it do very important for us to have the parental care. So therefore, it is quite important for a married couple to have a family planning before having babies. So for us to have a baby, we need to decide a lot of things. First of all, maybe we need to think about how many babies or how many children we would like to have. And apart from that, when will be the time for us to have the babies or have the children? This will be something that we need to design or think about. And apart from that, we also need to consider our health, financial condition to see whether the planning is suitable or not. So if a couple is not ready to have a baby yet, or if they do not want any more children, they will they can practice the birth control. Okay, some birth control that we can not to have a baby, but we will still have the sexual intercourse. So how can we do? We can have some birth control method. For example, we can prevent the release of ovary. Then how can we prevent um, the release of ovary, the ovum. In fact, will later on talk about. In fact, we do have some method. And apart from that, we can also need to think it in two principles. One of it will be just now we have mentioned release of the ovum, and the other one will be the preventing the fertilizations, so that we will prevent the sperms get in touch with the eggs or the ovums. And for the third method will be a little bit more difficult, which is preventing the development of the embryos. Okay, just similar the earlier stage of an fetus. So how can we do? First of all, we can do or we can eat the uh, contraceptive pills, which is a type of medicines that normally it is taken by the woman under the doctor's instructions. So it do contain some sex hormone to stop the release of the ovum. So for this method, in fact, is very effective. So for the effectiveness, it can up to 99%. While on the other hand, okay, there will be birth control by the man. In fact, we will use the condom. So how can we use it? In fact, we will put over the erect penis before the sexual intercourse, and in fact, there is a coating inside the condom. So it is often coated with what we call the spermicide, which is help to kill the sperm, which prevents the sperm from entering towards to the vagina. So apart from that, it could also provide protection against the sexual transmitted disease, for example, the AIDS. So the effectiveness is around 80 to 90%. So in fact, there will be some other more uh, not that useful method. For the first one, which would be avoid having sexual intercourse for a few days around the time of release of an ovum. So in this case, we can based on the menstruation cycle, we will know when will be the time that the ovum is released. However, it's very, very fluctuated because the time or the menstrual cycle is different every time, as it will affected by the stress, pressure, or maybe the personal feelings throughout the month. So in this case, although this method can prevent the sperms from meeting the ovum, however, the effectiveness is relatively lower, which is around just 76%. And then, okay, how can we have a more effective method? One of it would be what we call the male sterilizations, which is we try to cut, okay, or tight the sperm duct by doing some surgery. So in this case, we can prevent the sperms from entering the female's body, because we can see that when the sperm duct is cut, so in this case, the sperm could not transfer from the testis towards to the urethra. So in this case, the semen that produced or released by the penis, in fact, it will not contain any sperm. So for the effectiveness, it's nearly 99%. So apart from that, we will also have the sterilizations for the females. Okay, so in this case, how can it work? In fact, we try to cut the oviduct and tie up the oviduct by surgery. So in this case, we can prevent the ovum from meeting the sperms. So in this case, the ovum will be degenerated inside the female reproductive system. So in this case, the effectiveness is very, very high, which is nearly 99%, which is same as the male sterilizations. So for the fourth and also the fifth method, in fact, it is a permanent method, which means it only is suitable for the couples who have decided without or do not want to have any other children. So in this case, one we have done this sterilizations or this surgery, in fact, we no longer for these parents to have, or the couples to have the children. So or any other surgery can help having such birth control. In fact, there is one more, which is putting the IUD. So in that, the doctor will put these device into what we call the intrauterine uterine device, the intrauterine device towards to the uterus. So in this case, so once the device is put into the uterus by the doctor, it can prevent the implantations of embryos on the uterine lining. So in this case, the embryos or any fertilized ovum, or what we call the zygote, would no longer, okay, attach on the uterine lining. So in this case, the birth, there will be without a baby will be come out, because the uterine lining will be degenerate, and in this way the ovum will be also released throughout the vagina. So the effectiveness of these birth controls can up to also 99%. So in this case, we will see that there are some potential drawbacks of the birth control method. So in this case, I would like you to spend some minutes and pause the videos and work on it. So if you have already completed, you can continue to watch the videos, and if you have not completed, so please, okay, stop the video and try to work on it by yourself. So for the first one, okay, for the contraceptive pills, in fact, both C and S, okay, so it may cause some side effects such as some headache and also maybe some bad feelings towards the woman. And apart from that, it does not protect against the sexually transmitted disease, because we will see that the pill does not stop or does not prevent any cross of the body fluid, because we will say that in fact semen is a type of body fluid. So in this way, the sexually transmitted disease will be affected the girls in fact by the uh, uh, how can I say, by the transmission via the semen. So in this way, it would be also one of the things that we need to be aware of. So apart from that, okay, let us have a look on the condom. So for condom, there will be there will be several potential drawbacks. The first one would be it may break during the intercourse, the sexual intercourse. So in this case, if the condom is break, then it will be a big problem. In this case, it will be having a high chance for the couples to have babies. So apart from that, if we just simply based on the rhythm method, so which is a method that mainly based on we're looking at the date, then in fact it would be quite problems, quite a number of problems. First of all, the dates of ovulations may not be correct. So in this case, that means the date for the release of ova may not be correct. On the other hand, it also did not protect against the sexually transmitted disease. So for male and also the female sterilizations, so it would be quite easy because the potential drawback would be okay, it is irreversible. So this means that in this case, uh, the couples could not have the baby anymore, no longer to have the babies. So, and apart from that, as the semen will also secreted by the penis, and in this case during the sexual intercourse, so it could not protect against the sexually transmitted disease. And lastly, for the intrauterine devices, and that this would be one important drawbacks that would be two important drawbacks, and that it may cause the inflammations of the uterine lining if there is any disease or the uterine the intrauterine devices may be contaminated. Then in this case, this may cause the inflammations of the uterine lining. And apart from that, it does not protect against the sexually transmitted disease. So, in family planning, married couples decide how many children they want and when to have them. So, a couples can practice what we call the birth control to avoid having babies. Okay, so birth control to avoid having babies. So, in conclusion, the most reliable signs of pregnancy is the absence of menstruation, and parental care is important for the survival, growth, and also development of the babies. And married couples should have family planning to decide how many children they want and when to have them. So there are several methods or principles to control the birth of the baby. So for example, for first of the working principle would be by preventing the release of ovum, and the method would be the contraceptive pills, eating the contraceptive pills, and for the second working principle, which is what we call by preventing fertilizations, and that we can see that there are several birth control methods. For example, condom, rhythm method, male sterilization, female sterilization, by preventing the development of the embryo, and that we can see that we can try to input or put in the intrauterine devices towards to the uterine. So in this case, okay, we can try to do some practice for it. So please try to complete, okay, question number 1 to 3. Write a tick for a true statement, for a cross for a false statement. So in this case, we will see that for the irregular menstruation is a sign of pregnancy. So in this case, in fact, it would be pregnant women should not drink beer or wine. So in this case, this would be true or false. So please, okay, pause the videos and try to work on towards the questions. So if you have already complete, okay, you can continue to start. Watch the videos. Okay. So For the irregular menstruation, in fact is a sign of pregnancy. In fact, it would be not a sign, because irregular menstruation, in fact, it could be because of the stress or pressure that a person have, and without menstruation during that month would be a sign of pregnancy. So for the pregnant women, it should not drink the beer or wine. So in fact, it would be true, because it could be harmful to the fetus or the embryo. So married couples who are having difficulties getting pregnant can practice the family planning to help them have the babies. In fact, it would not be correct. So in fact, we are talking about those married couples who would like to have the sexual intercourse, but in this case, or who would like to have the babies, then they can practice the family planning to help them to have babies. So there are some common method, okay, common birth control method to help, okay, to control the birth of a baby. So it is used by the female. So in this case, it would be yes, okay. So it would be B, that means eating the contraceptive pills. C, putting in the place, okay, the intrauterine device. And E, female sterilization. And also F, the rhythm method. These would be some method that can be used by the female. And while which of the followings, okay, letters that is helped or it's used by the mouse? So in this case, the answer would be yes, A, and also D, and also F. Okay, so A, okay, you will notice that in fact for the condom is wear by the man, and for the male, the sterilizations, in fact it is a method that help to stop, okay, the sperm to get into the urethra. So for F, okay, it is the rhythm method. Okay, so in fact it is also the rhythm method is also uh, cooperate by both sides. Okay, it's not just only by the females. Okay, so in this case, okay, we can realize that in fact based on male and also based on gender, we can try to classify some of them. And apart from that, we can also have different types of matchings. Okay, for example, use with the spermicide. So in fact it would be the condom A. Okay, so in fact we will say that the condom inner part of the or inner surface of the condom, in fact it will coat layers or maybe coat some of the liquid which is containing spermicide, which to kill the sperm. Okay, so which is some permanent method. So in this case, it would be quite obvious, which would be the male sterilizations and also the female sterilizations. These two methods will be some permanent method that help us to control the birth. So once we have done these two methods, we will no longer can have the babies. Okay. So in this case, this would be the end of this videos or this sum up, okay, of and 4.5, okay, chapter 4.5. So please try your best to complete both chapter 4.2, the workbook, okay, chapter 4.2, 4.3, and also 4.5. Okay, for the extension part, which is you will see that in front of the question number in the workbook, you will see there would be a E, meaning that it is extension. In this case, you are not required to do it. Okay, you are not required to do it. Thank you very much. This would be the end of the videos. Thank you. Bye bye, and have a a joyful Lunar New Year. Okay, bye bye.